Hey everybody, Dr. Doug Lucas here, retired orthopedic surgeon now focusing my career on osteoporosis and longevity. If you've been diagnosed with osteoporosis or osteopenia and you're looking for the right physical activity to add to your comprehensive bone health solution, you're going to want to listen to this interview. I'm going to interview Rebekah Rotstein from Buff Bones. Buff Bones is a program that we've incorporated into our program of optimal bone health. It's a standalone program that's been around for years, and Rebekah is a wealth of knowledge around osteoporosis, having dealt with it herself. She talks about her own experience and story and how she built Buff Bones, what it's based on, and who it's good for. So stick around. I hope you enjoy the interview. All right, thanks so much for joining us today on our video. Today, I am going to interview Rebekah Rotstein, the founder of Buff Bones, which is a company that we have actually started working with optimal bone health to help to get people everything that they need for their bone health journey. So I'm really excited about this. Rebekah, to get us started, why don't you just give us a little bit of a background about you and your story behind bone health and really how you got started in this journey on creating Buff Bones.
Sure. Well, I was a former ballet dancer, like many others that we know, and I had incurred a number of injuries that eventually led me to find Pilates. And farther down in my path, I was teaching teachers, I was certifying instructors in Pilates when I decided to get a bone density test because of a course that I had attended where I learned that anywhere from 89 to 95, 98% of your bone density is actually built by the time you're finished with your teenage years, more or less. And so I figured I would get a baseline for later in life. And then lo and behold, it turns out I was diagnosed with osteoporosis. So this set me on this whole other trajectory and path to figure out what to do for my own bones and then how to help other people. And it's been an interesting journey because people just associate osteoporosis with senior citizens, and that's really not the case. At the time, I was only 28 years old. I am now 47, so it's interesting as I'm in this perimenopausal stage in the midlife that is the primary audience that we usually speak to. My own experience has changed, seeing it as a patient as well as a professional.
Yeah, that's great, and I really appreciate your honesty and your openness about your own story, because I think it's really helpful for people to hear that they're not alone if they're diagnosed with osteoporosis early in life. And by early, I mean in their 20s, 30s, and 40s. I see it all the time. And of course, we have a biased perspective because we see people that have osteoporosis, but it is amazing how commonly we see it. And most people don't know this about me. I've never said it on our YouTube channel, but I have a background in ballet as well. So I danced professionally before I went to medical school. And I remember the way that most people ate and the way that most people lived. And it is, if you think about what are the underlying factors of osteoporosis, a lot of them are there. The chronic stress, potential challenges around food, over-exercising, potentially under-eating. All of those things can lead to failure to achieve peak bone mass. And I think that is a really common reason why people have osteoporosis, but they don't know it and they never find out. They just learn later in life that they have osteoporosis. But I think it's really common, and we have no idea how common it really is. So that's great.
Well, something that's interesting along those lines is I think part of the reason is that the recommended age for the initial bone density test, a DEXA, is so much later in life. And I feel actually too late. So that if you really want to know what you have as your baseline to detect, especially as those menopausal changes occur for women, where we know you can lose up to 20% of your bone mass in those first 5 to 7 years, wouldn't it make sense to have an earlier test to have a comparison for later? And the general recommendations in the US are at age 65, unless there's an underlying reason. So,
right.
Maybe that's what something is that needs to change.
Yeah, absolutely. And I shout this from the rooftops. And it is challenging because from a public health perspective, who gets screened and why, so I understand why the recommendations are what they are. But at the same time, I totally agree with you that we're missing an opportunity to intervene early. And you probably know this, but it is so much easier to slow down and stop bone loss than it is to build bone. So how great would it be to know if you are, osteopenic or even osteoporotic in your 30s and 40s, as you go into the perimenopause window to say, okay, I know that I'm at high risk. This 20% loss, I cannot accommodate that with the bone system that I have. So I have to do something now before I get screened at 65. So I think that's really important. And that is honestly a lot of our patient population are people that are in that perimenopausal age group because they're really looking for those answers, which is, I think, really important. So then, Rebekah, let's talk about buff bones. So I kind of stumbled onto buff bones and I was immediately attracted to the message. Why don't you give people just a little bit of background on, why you created it and maybe some of the principles behind it?
Sure. So I created it because there was a gap. To be honest, there was nothing there that appeared relevant both for the demographic that I was looking to help, which was really people like myself right now and early postmenopause. But specifically, there were classes for seniors that were talking about bones, and then there were boot camps for younger people that didn't really address the needs of those in midlife, where your joints feel differently, your body feels differently, and your hormones are operating differently. And so I was looking for something that would be encouraging, but also accommodating, and also be enough, like sufficient enough to challenge in a way that is necessary for load as well as all the other elements in the body. And so that other aspect that I'm referring to is that, yes, we do need to add and increase loads as much as we can, but there's also other elements beyond just the bone density that I think are overlooked. And that's what I was also trying to address. So we're talking about mobility, we're talking about coordination, about balance, certainly alignment and posture, good arthrokinematics of the joints, how the joints can work together. And then also two things that are really overlooked, I think, in the bone health world are the relationship of the connective tissue, which addresses mobility and that feeling of stiffness, but also how your joints can work well and efficiently. And then something that is known as motor control in the physical therapy world, which is the sequencing and the timing and activation of your muscles. So I like to say that it's not just that you need strong muscles, but you need smart muscles. So you want your body to work efficiently. And I feel that element is widely overlooked when we hear about osteoporosis exercise. So I wanted a true full body approach that really integrates everything that makes a strong, resilient body.
Yeah, that's awesome. And so I get asked the question a lot about what is the best form of exercise? And it really depends on what your goal is. My goal with the Optimal Bone Health Program is ultimately to prevent falls and to prevent fracture. That is not the same goal as what is the best exercise to improve, bone density, to improve muscle mass. Because then you start going down this pathway of like, well, how heavy can I lift and how much impact can I get, right? And there is certainly an element of danger associated with that. And injury associated with that. So I love the idea of being able to do activities that are going to help train your muscles, smarter muscles, like you said, right? So not necessarily strong muscles, but smart muscles, and ultimately to prevent falls and having the balance, the coordination, the ability to get up and get down on the ground in a controlled manner, I think is really, really, really important and overlooked by certainly most trainers. And I say most loosely because there are some very good trainers out there, but I would say most trainers, and even often probably a lot of physical therapists that are really focusing on some very specific things. Because as we get into the subspecialties, we sort of put our blinders on and just focus on those things that we're experts in. But it's really nice to take a look at the big picture, which is what's important. And ultimately it's don't fracture, don't fall, don't fracture. And that's true for patients in their, 90s, 80s, 70s, but also in their 60s, 50s, and 40s. And I can tell you some stories about, fixing hip fractures in 40-year-olds and how it is impactful People think, oh, I'll just bounce back. No, I mean, I've seen it. People can bounce back, but that's not the common route.
And I think also it's interesting because people in midlife can often dismiss the importance of balance, thinking, okay, this is something that we do, in our 70s. But the fact of the matter is, I have never once had a single postmenopausal, and I would say menopausal, postmenopausal, let's say, age range, like let's talk about women in their 50s even, who has not had some form of challenge in balance. And, we're talking more than just standing on one leg. There are so many ways that you can challenge your balance. And not only that is, we're trying to think about prevention, right? So the more we can work on our bodies and take care of ourselves now, the better off we're going to be 20 years from now, 30 years from now. And it's the same thing, you go to a dentist and you're twice a year you go and get your dental checkup and you do your daily, hopefully flossing, but at the very least brushing your teeth, right? It's not that you're just waiting for a root canal. So why aren't we thinking the same way with our bones?
Yeah, absolutely. And I do a lot of talks on osteoporosis, just educational things. And I always show this graph, which it's great because it comes, straight from, I believe it's from the CDC, and it shows the percentage of death, and this is very morbid, but the percentage of death from cause. And so unintentional injury is always either 3 or 4, depending on the age group that you're talking about. But what's really interesting is that injury, what causes those injuries for, as you're young and as you start to age, it is generally motor vehicle accidents and overdoses. Those are the 2 most common. When you hit 55, 65, you start to see this box start to widen and it falls. And that box it's small, obviously, in your 40s and 50s. In your 60s, it becomes the vast majority of unintentional injuries that cause death. And then once you hit 75, it's the most common cause of death, actually, which is really, people don't really see that because we always talk about heart disease, and we talk about cancer, and we talk about dementia, and all those things are absolutely important. But what we don't recognize is how many of those falls there are and what the impact is. And the time to prevent those is not when you're in your 65, to 75-year-old age group. It's before that. Because, like I said, it's way easier to prevent bone loss than it is to build back bone. Possible to do both, but harder to do the latter.
Hey everybody, sorry to interrupt, but if you're enjoying this interview, please take a moment to like, subscribe, and sign up for notifications so we can let you know when we post new content on bone health. If you know anybody that would benefit from this information, please share this with them. The more people that see this information, the more the channel will grow and the more people we can educate on the topic of bone health. If you'd like to learn more about how we manage osteoporosis at Optimal Bone Health, look in the description for a link to our Masterclass. This free class goes through a lot of things that you can do on your own, some general education about osteoporosis, and how we manage bone health.
You mentioned that you really started investigating Pilates as you were struggling with injuries, and I did the same thing when I was in my own career struggling with injuries, and so did my wife, who was also a ballet dancer. And so we are very drawn to that, I think, for some very clear reasons as ballet dancers. But why did that for you make the foundation of buff bones? And if I'm describing it incorrectly, let me know. But why that, and why not some other forms? Because there are people that will say resistance training is the best thing, impact training is the best thing. There's a role in longevity for cardiovascular, training and cardio. So why not build those things in? Why really focus on the Pilates base?
That's a great question. So first of all, to clarify, we do use Pilates as the foundation in terms of the principles of Pilates, but it's not a Pilates program, because as many offerings and opportunities that Pilates offers, it is lacking in certain elements, specifically in aspects of speed, because it is all about slow control. It's also limited in its ability to add higher loads, because that's not the intention of it. Pilates is not about working to fatigue and to hypertrophy. So we try to bring in some of the other elements, but I would say the reason that I use that and the principles of Pilates as the basis is because it does create such a solid foundation for the body in an integrated manner, as opposed to a regular piecemeal approach that you often incur when you're talking from just looking at the body from, say, a medical approach. In all fairness, we tend to look very regionally. We don't look in an integrated manner. You have a perfect example is that what kind of specialty in medicine is there for osteoporosis? There is no kind of specialty that you would do, right? So, you would see an endocrinologist, or you see a rheumatologist, or an orthopedic surgeon, for instance. So the entire medical paradigm of treatment of anything is so segmented and then also reductionist. And one of the great things I think about Pilates is that as a mind-body form of exercise, it does allow you to look at the body as a whole and to see how everything is related. And so as a result, when you start integrating the breath and you consider whole body movement, then you start to change the entire, not only the mechanics of the body, but the way that the body responds. So I think that it's an incredible underlining to any kind of movement. But again, there's not one sort of movement form that's going to be great for everything, which is why we also bring in elements of progressive overload, why we also add in elements of speed, agility, reflex, why we also bring in other aspects coming from different parts of somatics or embodiment, also bringing in functional movement, because you need to make sure that you can do your squats and lunges and things that are going to apply to your daily life. And then, of course, other aspects of balance training, bringing in then obviously the strength element as well.
Yeah, that's great. It's a really nice combination. So in addition to if somebody's coming in and they're working with you through doing the Buff Bones program, and they're really diligent and they're showing up and they're doing all the videos, is there any, like, if you were to say there's one additional component that people should add, is there anything else that people do need to add, or is there something else that you think would be beneficial?
I do. And so I like to think of Buff Bones as the centerpiece of your entire Buff Bones menu, right? I'm sorry, osteoporosis menu.
Yeah.
So, this is what's going to give you the solid mechanics in your body to ensure that you don't injure yourself, that you're working efficiently, that you're not overstraining something. Because another thing that is really overlooked, and again, not talked about in the osteoporosis exercise world, is that when we're with a postmenopausal, and postmenopausal meaning the day after you stop menstruating for 1 year, so anytime from average age 51 through the rest of your life, you have a predisposition to tendinous injuries, especially hip tendinopathies. Again, not discussed very frequently. Shoulder tendinopathies. So what happens if you go straight into the gym and try doing all the strength training without the solid foundation? You exacerbate it, or you incur tears and then have to see a surgeon, right? So the point is, you need this underpinning for the solid foundation, but you really do ideally want to add as high of a load in different movements as your body can sustain. So for instance, deadlifts at the gym, back squats or goblet squats, different types of squats, and holding on to heavy loads. So, if you can tolerate that, again, it depends on your joint threshold and other conditions that might be going on in your body. But ideally, if you can work with a personal trainer to have the eyes on you at these very high loads, that would be ideal, because once again, there is no one answer. And of course, I think our society these days wants, give me the number one, you name it, for anything.
Right.
And the fact of the matter, if anybody tells you there is one exercise or one exercise form, I think that's very short-sighted.
Right. Yeah. No, I think that's really good. Yeah, I love when people ask me, just give me the one thing, or even worse, just give me the pill. I'm like, I left that style of medicine, right? Just give me the surgery that's going to fix my problem. And a lot of times there wasn't one, and it's really tough, being in the traditional medical model where we are, I kind of, as I got a little more jaded in my practice, I really felt like we're just widget makers in medicine anymore. And, I was there to operate. And so when people would come to me with, a tendinopathy or a fracture, my role was to fix the thing. I liked to talk about the background. I liked to talk about the hormone optimization. I like to talk about nutrition and diet and all those things. But we're not allowed time to. And I was actually told by my malpractice provider not to talk about nutrition because I wasn't trained in it, which really encouraged me to quit my job. So why don't you tell us a little bit more about who you think Buff Bones is good for, and then anybody that it's potentially not good for, if that person even exists?
Ideally, it's really wonderful for those who are in midlife or who can get up and down from the ground. That said, my mother, who is going to turn 77 in a couple months, is in terrific condition, gets up and down from the ground. She does our highest level of Buff Bones classes, but she has worked her way to get there. And so it really can be for anybody, and even those who cannot get down to the ground. We have special programming, actually. In fact, we ran a pilot study at Hartford Hospital's Bone and Joint Institute with this seated chair program for those who were lower functioning individuals in terms of physical capacity. So we do have options for all. However, I would say if you have had a fracture, an osteoporotic fracture, you do need to make sure, you should always have any kind of clearance from your physician to make sure that you're allowed to be doing stuff. But especially after a fracture, you need to make sure that is healed. And I highly encourage working, whether it's one of our Buff Bones instructors or a physical therapist who is licensed in the method of working with people with post-fracture, I should say, treatment. I think the most important thing is if you've had a fracture, make sure that you're cleared and make sure that you're getting the personalized guidance, even if it's just eyes on you once, to give you some clues to make sure that you don't re-injure yourself, and to understand the things that you should be doing.
Yeah, no, I really appreciate that. And everybody struggles with that. The question of, can I do this? Can I do this type of activity? When patients ask, it's a really hard question to answer. And what I think is really important that we impart to people is that your doctor doesn't know. If you've had a fracture, then maybe they're going to have some inkling of what your limitations should be. But they're always guessing, and they're always going to be very conservative because of the conservative nature of medicine in general. Any recommendation we make that can come back on us as physicians, we're going to be extremely conservative in our recommendations. So that's where I think the recommendations have gotten almost a little bit silly, with the amount of weight that people with osteoporosis should lift. Don't lift more than 3 pounds, you might have a fracture. If you haven't had a fracture, that's probably not true, but I can't even say that, right? So it's just such a challenging question to answer. But I think anybody can start with the simple things, the getting up and down, learning good positioning, all those things are important, and then progressively overload. But that means something different for everybody.
And that's also a really good point, because it is very different for everybody. What might be a maximum percentage of my maximum capacity could be very, very different for somebody else based on whatever their medical history is, their age, other issues that they're encountering, and also their own injury history. And at the same time, another thing that I don't think is mentioned enough is osteoporosis is such a broad term that defines such a vast epidemiological continuum, right? Yeah. So you can have somebody, I'm no longer classified as osteoporosis. I'm now classified as low bone mass or osteopenia. However, there could be somebody else that may have the exact same even T-score or Z-score in my case, and yet their capacity is very, very different. And even without that, you talk about two different people with osteoporosis. You could have somebody with a very high bone density, not high bone density, but within that spectrum of osteoporosis. Maybe they're just on the cusp at minus 2.5. Then you have somebody who's in the -3s who is possibly much more susceptible to fracture. And there are so many variables, as you know, and I think that's one of the great things that we're both trying to get the word out about, is to explain that it's not as overly simplistic as it's made out to be. And yet it also in some ways can be simpler and certainly less fearful than it is also made out to be.
Yeah, it's one of the things I really dislike DEXA for a lot of reasons. We're kind of stuck with it, and we have to use it. But I think that it can cause issues on both sides of the spectrum. It causes unnecessary fear, and it causes unnecessary lack of fear and brazen ideals and movements, because I think that it can be misinterpreted. So, all right, last question. What are your favorite, let's say, 1 or 2 resources for people that, let's say it's somebody who's just diagnosed with osteoporosis, they want to learn more? Where do you tell people to go?
One is I have people go to the Bone Health and Osteoporosis Foundation. I think there's a lot of information there. And full disclosure, I'm also on the Ambassador Leadership Council for them. But I also, I actually reached out to them because I really liked the way they were presenting information. And also another is American Bone Health, another that I also do work with. But again, I have no paid interest in this. I volunteer with both. But I think they're great resources for people. I will tell you that we have a 10-day challenge that I also tell people to start with as a great way to understand the elements of how to get started with exercise for your body before you're even thinking about bone density. And I would say these but those other 2 are sites that I think are really, really useful and helpful for people to understand, what does this mean? What's going on in my body? And I also do like, there's a book that I think is very useful that I found very helpful to myself when I was first diagnosed. And it was extremely comforting for me, which is called Better Bones, Better Body by Susan Brown. And I want to call that out because I think one of the biggest overlooked aspects about osteoporosis is the fear element. And people don't, again, this is not just the physical body, it's the entire body. And again, the emotional aspect and the emotional toll that a diagnosis can take on you. I don't think is considered enough within the medical community, and certainly by bedside manner by a number of physicians when they understandably are wanting you to take it seriously, but perhaps not recognizing how seriously you could take it and the fear and terror that it can impose upon a patient. So when I read that book by Susan Brown, it really, it gave me an opportunity to take charge again of my feelings about my health. So I want to offer that patient to patient for others as well.
Those are all great resources. I agree with everything you just said. So Rebekah, this has been great. I really appreciate your time. I think our viewers and listeners are going to like this too. So I look forward to seeing how the Buff Bones program works with optimal bone health. I think people are going to really find the 2 working together is going to be a nice, a magical combination of comprehensive approach to managing bone health. So super excited about this partnership, and thanks again for your time.
I'm excited as well. Thank you, Doug.
Thanks so much for making it to the end of the video. I hope you enjoyed that interview with Rebekah Rotstein from Buff Bones. If you enjoyed this, please sign up for notifications, like and subscribe to the channel so we can let you know when we produce more content. If you know anybody that would benefit from this information, please share this with them so that they can learn about osteoporosis and about how a comprehensive approach can really help to make an impact on their bone health. If you'd like to learn more about optimal bone health, about how we manage bones, look at the description below and you'll see a link for the Masterclass. Click on that link and you will be able to sign up for our free class where we talk about how we manage osteoporosis, tips and tricks for how you can manage your bone health at home, and a lot of things and tools that you can do to help optimize your bones. And lastly, I want to hear from you. We love comments on our YouTube channel. All of the comments help to answer questions that other people also have, but are too afraid to ask. So please leave your questions below. We'll get to them as quickly as we can. If you have any topics that we haven't talked about that you want to hear, leave those below as well, and we'll take the most commonly asked about and favorite topics, and we'll create content on those things. So thanks again so much for listening.